This is just not the day for technology. Alrighty, so again, my name is Valerie Leonard. I'm the founder of Nonprofit Utopia. We're the ideal community for emerging nonprofit leaders. Our mission is to train the next generation of ethical nonprofit leaders, and our vision is to train 50,000 ethical nonprofit leaders around the world between now and 2033. We've been focusing this month on strategic planning, and we've gone through a number of steps to show you how to prepare as well as to start the strategic planning process. Today, we're going to focus on how to develop a one-page strategic plan. And what we covered before was the community needs assessment. We felt it important to share with you how you go about looking at the needs as well as the assets of the local community, identifying issues, but most importantly, identifying the assets in the community that can help you address those issues. And those assets would be people, and bear with me, I just, alrighty. I just want to make sure that I'm sharing the screen and you guys can see what I see. So I do apologize for that. So it's very important to not only look at the needs of a community and the issues, but to look at the assets, look at the people in the community who can solve the problems, look at the institutions, look at the organizations. After that, we looked at taking all that information together and developing a theory of change. And basically what a theory of change is your way of dealing with the issues in an evidence-based way. So you're looking at the data that lets you know what the problems are, and you're also using those same data to brainstorm around the solutions with the goal of looking at cause and effect. All right. And then after that, we talked about looking at your organizational stakeholders to assess their capabilities. And organizational stakeholders always begins with the organization itself. So you want to do an assessment of the organization, look at where it's weak, where it's strong, and you do the same thing for your partners, you do it for your clients, and then you do it for your competitors, trying to get a sense for, who cares about the issue, who might be friend or foe, and how they may help or hinder your process. And then based on all of that information, then you develop your mission statement. And basically your mission statement tells you your why and who you're serving, why you're doing it. And then after that, we talked about the vision statement. And the vision statement is basically a broad statement of what is going to change in the world, in the community, as a result of the interventions that you provide. And then after that, we talked about core values. And those are those absolutes that you use to make management decisions, make strategic decisions. And, they're basically the things that are most important to you. And then after that, we talked about how to craft a mission, vision, and core value statement. So we're not going to go into a whole heck of a lot of detail. You see, we covered a whole lot. You can go to YouTube and check out our videos. All right, so today we're going to cover sample strategic plans. We're going to also go over the on-strategy model and their example, and then we'll talk about the balanced scorecard model and share with you some examples. All right, so before I go further in this presentation, I just want to give you an example of a traditional plan. Hello, Leslie, and hello, Carlina. Thank you so much for joining us.
Thank you for having this presentation, Valerie. I really appreciate it.
All right.
Hi, Carlina.
Hello. Hi.
All righty. Carlina is our marketing associate, and Leslie Page Piper is one of our founding members. And I just wanted to share this strategic plan with you, to share with you what a traditional strategic plan looks like. And I also wanted to give you a faith-based model so that you might have some examples. Can you guys see my screen?
No.
Okay. All righty. All right, so this is a traditional strategic plan, and this is by Brighton Heights Reformed Church. And this example was provided by On Strategy. I just wanted to, I'm not going to go into a whole lot of detail because you can see this is a very long plan, but I just want to give you a sense for what a typical traditional strategic plan would look like. So they've given an overview, they've shared their vision, they've shared strategies and next steps, and then they gave a summary report, a retreat agenda, ministry teams, and a needs assessment, all of that stuff in the appendix. And they shared their vision not only for the church itself, but for the various components, for the membership, for administrative and communication, community service, spiritual growth, finance and stewardship, and facility and property. All right. And then they shared for each one of those segments, they shared their goals and objectives and gave you a timeline. All right. So that's pretty much how this is structured. Now, we're going to compare that to a one-page plan. All right, and this is an example from On Strategy. This is their typical format, and one of their clients was the Downtown Family Dental Care office. So they started off with their mission, and then they included their core values, their competitive analysis and strategies, and then they also, they talked about how they would win and how they would play. And then after that, they shared the strategic priorities. And then they talked about their KPIs, or key performance indicators, the vision, and the implementation. All of this on one plan, on one page. And as you can imagine, trying to get all of this information on one page necessitated very, very small type. All right. So the mission is to deliver timely, affordable, and top-notch dental services for their patients, resulting in a healthier local community. Their core values, and they summed it up as how will they behave? Their core values include preventative health, a patient focus, respect and camaraderie, learning excellence, community health, and they want to make sure that they were having fun along the way. And then when it comes to the competitive advantage and strategy, so the competitive advantage answers the question, how will we win? So they have three competitive advantages. The first one is we excelled at building lasting, trusting relationships with our clients through high-touch relationships and premium patient service. 2, we are industry leaders in leveraging and aligning innovative technologies with office process to more effectively manage patients and our staff. And 3, we invest heavily in ongoing professional development for the staff for sustained industry leading practices. Okay, so those are the competitive advantages. And then their strategies answer the how. So to grow the practice one patient at a time to achieve 400 patients by 2017 through unmatched patient service, which we will accomplish by offering trusted, affordable, and personal dental services in order to support preventive oral care in our local community. All right, so when they looked at their strategic priorities, they looked over the 3-year horizon, and then they also shared the goals. All right, so their financial results, they wanted profitability improvement, and then their goals, their priority is to maintain a 35% net profit margin each year. And their goals that will support that strategy, the first one is reinvestment. Maintain profitability with a budget allocation of 20% for business reinvestment. And then their second goal is revenue. Increase average revenue earned per clinician hour work to $400 an hour. So these are very, very strategic. These are definitely SMART goals in that they're very specific, they're measurable, they give a sense. I'm assuming that this is within their realm of capability. So they're achievable, they're realistic, and they're timely because they give you a time period within which they're going to do it. Because remember, this is within 3 years. All right. So the next section is customer success. Patient retention to build long-term loyal relationships with our clients. And the first goal under customer success is existing clients. Improve patient retention by 12% year over year to achieve 76% patient retention by end of the year 2015. And their second goal is under patient satisfaction. They want to achieve a 90% client satisfaction score on our annual satisfaction survey. So they have ways of also measuring. So they've got targets and they've got ways to measure it. Under operational excellence, their strategic priorities are, first of all, clinical technology. They want to continue to simplify and streamline processes through the usage of new technologies. And then for marketing, they want to make their name known within the local industry. And then they've got looks like 4 goals. Their first goal is to convert all patient charts to digital chart programs by end of year 2015. Under scheduling, they have implement a new scheduling software to allow clinicians, hygienists, and office staff remote access to up-to-date office schedules. And then under social media marketing, they want to establish an online social media presence and strategy to build an organic online following. And then for their website, they want to update the look and functionality of their website, adding a direct contact form, staff biography page, and a variety of client testimonials. And then lastly, under people expertise, they have one strategic priority, and that is focusing on their team. They want to actively help the team to develop and grow professionally and personally by supporting a flexible work life, providing intellectually engaging work, and fair compensation. So they've got 3 goals here. And the first goal is under training, formalize an onboarding process for new hires for a quick and effective integration into the office. Their next goal is under professional development. They want to achieve timely completion of education requirements by requiring each hygienist to complete a minimum of 8 contact hours each year to meet the 24 required hours per 3-year registration period. And then under leadership development, they want to have each dentist and specialist attend at least one dental conference each year. Okay, so they're very, very specific. And then on the far right, we see how they're going to measure it. And just bear with me, I need to move something out of the way so I can see. All right, so under KPIs or key performance indicators, the first question they ask is, how do we measure success? And they've got 4 different measures. The first measure is average revenue per month, and their target is $70,000 a month. The average revenue per clinician hour worked is $400. And then the average number of new patients per month is 3 a month. And then the average operating cost per month, $45,000. So they're very, very clear in terms of what they want to achieve and how they're going to measure their success. And then their vision, they're asking the question, where are we going? We envision being the leading dental practice, improving our community's health and well-being, one patient at a time. And the implementation, how will we hold ourselves accountable? I think it's brilliant that the first question they ask is how they're going to hold themselves accountable. And the first thing they do is appoint a strategic plan leader, and then they're going to hold quarterly strategy review meetings, and then they're going to post the strategic plan in the office for continual reminder, pretty much like what you would do for a mission statement. They want to make sure that they align performance management and oh my goodness, compensation bonus structure with the strategic plan. So basically what this is saying is if you're a manager, if you're an employee at any level, if any if you have any responsibility for making sure that the high level strategies are in fact achieved, then you're going to be held accountable within their performance review, within your pay scale, which I think is really critical. And then they want to host an annual planning retreat in January of each year. So they basically institutionalize their strategic planning process. And generally speaking, most strategic plans have this kind of information, but they may cover it in 25 pages, 30 pages, or even 100 pages. And you can go through this whole process, within a brainstorming environment within, 1 or 2 days, depending on how complex your organization is. All right, and here is an example. This example is from the On Strategy library, and this is the Free Store Food Bank. And you notice they have a disclaimer. This document is meant to support and inform, but not to displace existing departmental work plans. And the reason I'm sure they put that there is because they tried to get as much information as they could on one page, and they couldn't put all the backup here. So this is just to give you a very high level summary. So they've shared their mission, vision, and core values, and then they've also shared their goals, objectives, and strategies. So the vision is to be the leader of a community mobilized to end hunger and address its causes. And their mission is to provide food and services, create stability, and further self-reliance for people in crisis. And the values are they're committed. We will not accept hunger. They have compassion. We embrace diversity. They have respect. We're in service with our neighbors. And then empowerment, those who we serve can succeed independently, so they're not trying to swoop down and become the savior of people. And then community, we collaborate with others to improve our region. So they're not trying to operate tower and then dictate from on high what goes on. And if you are with us, if you have any questions, please feel free to post them in the chat room and I can follow those. If you are listening from YouTube or Facebook, then I will make sure that I can answer those questions after this is over. All righty, so I'm not going to read all of this stuff, but I just want to give you a flavor. Their goals are aligned under different themes. They've got one theme, how can I help? Another theme number 2 is excellence. Theme number 3, interrupt the cycle. And 4, tell our story. So under how can I help, they have 5 objectives, and the first one is help us connect our customers to our services. So they're trying to at this point be very focused on the end users and their clients. And then the strategy is seek out and take advantage of new technologies. And they've got a whole list of their strategies. All right, are there any questions before I go to the balanced scorecard?
No questions on Facebook.
All righty, thank you. All righty, so the balanced scorecard, you may have heard of it. It's a management system that gives feedback on the processes as well as the internal and external outcomes. All right, so you're bringing together those measures around internal processes and external outcomes, and a balanced scorecard supports continuous improvement at the level of strategic performance and results. So basically what it seeks to do is, after you have studied the environment, looked at who the major players are, looked at what the issues are, the assets, and all of that good stuff, it seeks to help you map out your strategies and make sure those strategies are aligned from the top down. And when I say top down, I'm talking about at the highest level, so the board and organizational level, drilling all the way down to the individual level to make sure that there's accountability. All righty, and typically it's divided up into 4 different segments. You have the financial, the customer, the business process, and the learning and growth. And for nonprofits, they often use, instead of learning and growth, they'll use capacity building. So for this is for for-profit, is the perspective of your shareholders. If you're a nonprofit organization, you're looking at how you can provide the perspective of, say, your board members or your funders or your stakeholders. And remember, when we talk about stakeholders, we're talking about anybody who is interested in your success. All right. Customer, you're looking at what your customers experience and how they're going to perceive it. So this is very much aligned with, examining the customer experience, looking at branding, and being able to segment and differentiate yourself in the marketplace. Under business process, those are those key processes that you're going to use to meet and exceed customer, and we'll call it stakeholders. So stakeholders could be shareholders, but if you're a nonprofit, a stakeholder again is anyone who has a vested interest in your success. So you want to be able to put those processes in place from an operations standpoint, from a programmatic standpoint, to make sure that you can achieve your objectives. And then under learning and growth or capacity building, you are going to take those results of your assessment and look at ways that you can come up with strategies that will help you to build the capacity to be able to meet your overall objectives for the organization or for the program. And since we're talking about strategic planning, we're actually talking about at the organizational level and not the program level. Alrighty, so this is the framework. This is a visualization of the framework, and this comes from the BS Institute, BSI, and BSC is the Balanced Scorecard, and the BSI is Balanced Scorecard Institute. All right, so you start off with improvements in internal capacity. And the way you arrive at that is you do the assessment of your organization, your clients, your partners, looking at the strengths and the weaknesses, opportunities and threats, and all of that good stuff. So anything that's going to impact the capacity, that's going to drive your internal processes. So what processes do you need to shore up in order to make sure that you can achieve your goals and objectives and complete the strategies? And that is going to drive customer and stakeholder satisfaction, looking at what's important to them. And then, once your stakeholders and customers or clients are satisfied, that ensures, or hope not necessarily ensures, especially in this day and age, it increases your chances of creating a sustainable organization financially. So that's going to drive your financial results. And after you go through that process, then you develop a strategy map. So again, that's, it doesn't show here, but you should have gone through a community needs assessment and ideally a theory of change that's based in data and that's going to give you the cause and effect relationships between the strategies that you're proposing and the people, who actually need the help. All right. And it's really going to tell a story as to how you're going to do it. So again, you're starting off with organizational capacity. And generally speaking, in this example, you want to improve the knowledge and skills. And again, this example comes from the Institute. All right. So this is you want to improve knowledge and skills, improve tools and technology. And then after that, you want to look at what internal processes can be streamlined. So you want to streamline them in such a way that they either lower costs, so it's going to have a financial impact, or it's going to lower the cycle time. So the time it takes you to develop the program or service to the time that it gets to market. And that's going to impact at the customer level. And the faster you get your products and services to market, the lower the wait time, and you increase your chances of improving customer retention, and that will increase revenue, which in turn will increase profitability, assuming that you keep your costs low. So increase revenue and lower costs. And hopefully when you increase revenue and lower costs at the same time, you're not doing it with the vulture mentality. You want to be efficient with your resources, but at the same time, you want to be able to maximize impact to clients and communities. So you don't want to, cut down to such bare bones that you forget about, who's important, which is for nonprofits, your client and community. You're not necessarily trying to drive shareholder value. All right, so the leading question is how, and then you also not only want to ask the how, but when. Make sure you stay on track. And this is a framework as to how to develop operational measurements or key performance indicators. And this example is for a for-profit example, but it can be also used for nonprofits. All right, so you start off by looking at the inputs. So those are the resources that you need. So that could be people, that could be money. Then you look at the process. And for nonprofits, we're looking at programs. All right. And then after that, you'll look at the outputs. I'm sorry, process. Not only are you looking at programs, but you're also looking at activities. And then you're looking at the output. So what units of service can you measure? Are you actually producing it? So it's the number of workshops, number of programs, number of publications, depending on what your program or service is. And then you're looking at your intermediate outcome. So what's going to happen in the short term, and then what's going to happen long term as a result of your strategic plan. All right, so you want to make sure that you share this across the board so that you increase the intelligence of the strategic alignment, from the top down. So it's not just the board, it's not just the executive staff, but every employee should have some familiarity with what's going on strategically. Your receptionist has a role in making sure that the organization meets its mission vision. All right. So this is the one-page strategic plan. And this is from the balancescorecard.org organization, Balance Scorecard Institute. So this is an example from a municipality. So they start off, everything stems from your core values. Your core values are going to color how you develop your vision, mission, and strategic themes. And again, this also assumes that you have done an in-depth review of what's going on in the community. So the vision is to be a world-class model for a successful urban community. The mission is to provide effective and fiscally responsible services in a manner that promotes high standards for community life. And then they have strategies along 4 different themes. One is government reform, the other is nurturing children and families, the other is public safety, and the other is economic abundance. And if they're successful, this is what they plan to see, or this is what they expect to see from their strategic results. They want to maintain an ethical and transparent government that engages its constituents and provides effective and efficient services. They want to create a safe, thriving, and engaged community so families can flourish through achievement of social, mental, physical, and cultural well-being. And then on the public safety side, they want to create and maintain a safe, secure, community-oriented city that's clean and vibrant. And under economic abundance, they want to offer abundant opportunity for financial stability and advancement for all socioeconomic levels. And here they've looked at their organizational capacity, their internal process, their financial stewardship, and then their constituent or stakeholder. So they rearranged the levels, and they slightly changed the name somewhat, but it's still the same framework. So under organizational capacity, they want to increase staff quality and improve the utilization of technology. Under process improvements, they want to improve the delivery of services. So that means they're going to have to look at, I guess, a flow chart of how the services are delivered and identify any bottlenecks or any problems and eliminate those. They want to improve efficiency and effectiveness. And then they also want to improve promotion and marketing. So going back to efficiency and effectiveness, they want to make sure they're not wasting money. And they also want to make sure that when they deliver programs and services, they're actually making a difference. And that in turn is going to impact their financial stewardship. So they want to reduce waste and improve land and asset management. And then for improving delivery of services, that's going to directly impact their constituents, who is also a stakeholder. So they're going to improve their outcomes. And then under improved city promotion and marketing, that's going to have a direct impact on their ability to improve awareness and accessibility of those programs. And when you improve program outcomes and when you improve awareness and accessibility to the programs, assuming everyone is using them, then you're going to have an increase in the quality of life. Now, this section here gives the measures and the targets, all right? So they have a whole list of how they're going to measure their impact, and I'm not going to read through all of them, but for example, they want to see the livability satisfaction score. They want to see it increase. So they will consider themselves successful if more than 90% of the people who are surveyed give them a very high score. So they want to get a score of more than 90% on this test, right? And then some of the initiatives are the Green Space Program, New Business Startup Program, Community Engagement Committee, and Partnering Program. So they have, again, a whole list of measures, a whole list of targets, and then these initiatives are ways that they're going to actually reach their targets. And as we'll discuss on Friday, this information can also be used to develop a scorecard that, that they can see at a glance, whether or not they're making any headway. All righty, and then finally, you want to make sure that your strategies are aligned from the top down. So the top tier is the organization, and we'll say board, right? So that's tier one. The second tier is, depending on the size of your organization, your second tier could be the departments. The second tier can also be your business units. And for a nonprofit, instead of business units, that could be your programs and services. And then tier two also is your support unit. So that could be things like your fundraising. It could be, data. It could be fundraising. It could be finance. It could be marketing, advertising. It could be all of those things that are important to the health of the organization, but are not necessarily directly impacting programs, such as your programs would do. All right, and then tier three is teams and individuals. So this model builds in accountability at the individual level. All right, so again here, in summary, everything flows from the mission, visions, value, strategic themes, and results. And then you want to have your tier one, which is, at the organizational level, right? And then tier two, again, that is the department's business units or programs, if you're a nonprofit, support units. So things like fundraising and marketing and finance. All right. And then after that, you have your personal objectives, measures and targets and initiatives. And then you want to make sure that you pull out things in the job description that are in alignment with the organization's strategic thrust, to make sure that at every level, everybody is in alignment with the strategic plan. All right, and here is an example for social services. And let me go back. I'm using a touch screen, so I didn't mean to do that. So this is an example for a social services organization. So they put their clients on top, and they've got financial output, right? So they want to make sure their mission is served. So their mission is connecting a community of volunteers to support the dignity of those needing a hand. So if they're doing the work correctly, they're going to see an impact to their clients and to the financial health. So you want to start off at the bottom. This is their learning and growth or capacity. So they want to make sure that they're providing inspirational leadership. They want to make sure the staff and volunteers have the tools that they need, so there's ongoing professional development. And then they want to make sure that there's a positive culture that will support that, have people buy in. And then internally, these are the systems that have to be in place in order to make sure that you have a positive impact on the client and the financial health. All right, so under making a difference, they want to ensure program impact. They want to partner with others to make sure that they can expand and even maximize their reach, create scale. And then they want to manage programs as a portfolio. So clearly this is for a large social service agency. And then they want to make sure that they hear the voices of those needing a hand. So they want to shape the state and federal agenda. So that's policy and advocacy. They want to leverage their volunteers and donors to drive change. So they want to make sure that the fundraising is not just with their staff, but they want to make sure that the board and volunteers actually are helping out with that. And then they want to make sure too that they have identified the local needs so they know how to raise funds and where that money should go. And they most importantly want to make sure that they're advocating for the right causes that will maximize impact for their clients and community. And then they also want to make sure that there's operational excellence. So they want to establish a reputation for excellence, and they want to diversify their revenue streams. And all of this together is going to impact the quality of the service that they provide to their clients. They will, if they do everything right, they'll be able to provide for fundamental needs for their clients and help them actually become self-sufficient. They will ensure that the service is available and again, promote self-sufficiency. And then over time, the organization remains healthy and viable. And if you're in an organization that's not healthy and not viable, this whole process will help you align those strategies and resources and processes that you need in order to get there and deliver value for your clients. All right, so we're running out of time. Here's an example for a homeless shelter, and here's an example for early literacy organization. And if you are a member of the nonprofit Utopia community, we will have examples, that you can download and view at your own leisure. All righty, so we are coming to the end of our program, and I want to encourage you, anyone who is not a member and you've watched this and you find that this could potentially be helpful to you, if you join within the next 24 hours, then you will get a free coaching session through every one of these tools that we've just shared for the month of August. If you are a member of the nonprofit Utopia community already, you will have access as well to those different tools. All righty. So if you have any questions regarding this webinar, you can email me at ValerieFLeonard@nonprofitutopia.com. And members can always post questions in our forum, and we'll have different resources for you to use as you enter into your own strategic planning process, whether it's a traditional strategic planning process or the shortened one-page version. All right, so you can join Nonprofit Utopia at nonprofitutopia.mn.co, and you can follow us on Twitter at Nonprofit Utopia, and you can find us on Facebook. And without further ado, I'm going to stop the share and see if there's any questions or comments.
No questions on Facebook.
All right.
Thank you for sharing this, Valerie. It's very valuable information. I hope everybody that's listened has appreciated it, and they will join in, those that are already not members, and take advantage of your offer. I think it's quite a appreciative thing. Okay.
All right. Thank you. And that was Leslie Page Piper. She is one of our founding members. All right. So without further ado, I am going to head out. I thank you guys for joining us. Again, if you have any questions on Facebook or YouTube, please feel free to post, and I'll respond as soon as I can. Take care.